Welcome to this event, Local Justice Innovation for Trailblazers in Conversation. It's the second online event in our series of work called Expert Voices. My name's Phil Bowen. I'm Director of the Centre for Justice Innovation. The Centre is a not-for-profit that works to make the justice systems of the United Kingdom fair and effective. And this is an event which we've been much looking forward to, celebrating the work of four organisations and individuals who have received our Justice Innovation Awards. The format of the event will be, I'll provide a very quick overview of those awards, and then we will go into some presentations from current and former winners about innovation, and then have a dialogue with them and then with the rest of you who are on the call about innovation in the justice system, which is not always easy and sometimes can feel quite hard. So just a bit about the Innovation Awards. So we set up the Innovation Awards about 4 or 5 years ago to recognise the work of frontline practitioners and innovative projects which seek to improve outcomes and make the justice system fairer and more effective. So each year we come up with a shortlist. That shortlist is selected from the projects that were added to our map of innovation since the last award. So just a little bit about the map. So we currently have a map of innovation that covers criminal justice and family justice, spanning England and Wales, Scotland, Northern Ireland, the whole of the UK. And there's about 200 odd projects on it. And those projects kind of exemplify what hopefully this conversation will also exemplify, which is the great work that happens, sometimes unrecognised by the public, certainly unrecognised in some of the public discussion about justice, but good work that happens on the ground. Just as a little bit of background to this event, so there are two people and two projects that I'll introduce in a bit of time who were the winners of the awards back in, we were going to present them with their awards back in December 2021, but couldn't because of Omicron. So that event got cancelled, and then we were going to present them with the awards in September 2022, and that event got cancelled when Her Majesty the Queen passed away. So this event has in part been a long time coming, and so thank you to winners of awards, former winners of awards who have waited a long time to come to an event about it. So we have two awards at the centre. One is the Nick Crichton Award for Family Justice, and the second is the Criminal Justice Innovation Award. And I want to talk just a little bit about those two awards separately. So the Nick Crichton Award for Family Justice is named after District Judge Nicholas Crichton, who was the first judge who brought over a model of practice called the Family Drug and Alcohol Court, brought it over from America, adapted it and changed it, and set up the first Family Drug and Alcohol Court back in 2008. FDACs now, since that project, there are now 14 across the country, including the first one that was set up in Wales about 18 months ago. And FDACs, as they're called, are an important part of the family justice system. And we wanted to honour Nick's memory. Nick unfortunately passed away a couple of years ago. We wanted to honour Nick's work because he kind of exemplifies some of the things that we love about working in the justice system and working with practitioners. He was humane, compassionate, focused on trying to make improvements in the lives of people who were caught in the jaws of circumstances beyond their control. And FDAC to this day remains a shining beacon of hope in the family justice system. So the Nick Crichton Award, it's the 4th year that award has been awarded. It's sponsored, the award itself is sponsored by a consortia of funders, including Hall Brown Family Law, LCM Family, Family Law in Partnership and Ad Council. And I'm delighted that today we've got the winner of the Nick Crown Award for this year, 2023, was Lifelong Links. I'm delighted we have Kathy Ashley, Chief Executive of the Family Rights Group, to speak about that project today. Also delighted to have with us Amanda McIntyre, Deputy Chief Exec of the For Baby's Sake Trust, previous winners of the Nick Crown Award for Family Justice. Moving to the Criminal Justice Innovation Award, which is funded by the Hadley Trust. So again, we have Martin Bowick from the Right Hook Project, which is this year's winner of the Criminal Justice Innovation Award, and he'll be doing a short presentation later on. And we also have Naomi Jackson from Probation Board for Northern Ireland, Area Manager for the Aspire Young Men's Project, which is the previous winner of the Criminal Justice Innovation Award winner. So yes, just in terms of format, so we will, I'll call on Martin to do his presentation, just to give us a bit of an overview of the Right Hook project, then ask Kathy to do the same for the Lifelong Links thing, and then ask Naomi and Amanda to give brief overviews of their work. And then we'll get into the Q&A. So hoping that the magic of Teams works, I will hand over to Martin to do his presentation on the Right Hook project.
Right, fab. Yeah, good morning all. Yeah, I'm Martin Burke. I'm the coordinator of the Right Hook project, which is a project running on the Cynnon Taff and Merthyr Tydfil in the South Wales Valleys. It's a brief overview. Also, we have some questions and answers later, so let's go through this as painlessly as possible. Right, so the method of actually using the Right Hook, or the way it came about, was in 2019. I visited Fight for Peace in London. I was invited up, and I liked the method they use, which are using combat sports and martial arts to engage young people. So I came back to South Wales and flipped it on its head and started up from within inside an organisation, which is a statutory organisation. We're not a martial arts project, we're also a youth offending service. So we looked at a thing. We basically had an audience there ready. We work with young people who are heavily involved in crime, antisocial behaviour, violence, etc. So we set the project up and looking to engage the young people in a positive light, using combat sports as a tool to engage them. So do you want to skip the next one? Sorry, Duncan. Yeah, so as it says on here, we realised that, and we spoke with young people beforehand, and we visited quite a few different gyms and stuff like that, and spoke to a lot of people on the streets. And boxing and martial arts still has that machismo about it. Young people are interested in getting involved. They didn't like being involved in other projects, which is your mainstream, such as football and so on. They liked to have something that they could push themselves. And when we spoke to them about obviously building discipline, self-respect, it did hit home with young people that there's a way that they could actually engage in something, feel good about themselves, and understand the ethos of respect between participants, between coaches, between staff, and it worked really, really well. It is working really well. So part of the sessions is training, and then we move on to personal development sessions, which is the week, and we use the sporting aspect to actually engage them in the personal development sessions. If you want to move on to the same, Duncan, thank you. Yeah, as a personal development said, as it says there, it's very informal. We run the sessions in the gyms or in the halls, so we will train the young people for 45 minutes to an hour, and then we'll literally sit down in the gym on the floor. It's very informal, and we can talk about everything and anything, and it's a really good way of young people for the barriers to be broken down. And we'll actually bring in, we've had officers from the CID come in and train with the young people, and they'll sit down and discuss things with them then, and it breaks down the barriers. We'll have drugs workers come in, we'll have school teachers come in, And it's just a very informal way of young people feeling confident and being open and honest with each other and ourselves. And we literally talk about anything and everything, whatever the young people need to speak about, or they feel is a problem for them, or a concern for them, for themselves or their community. Then that's what we talk about on the day. We've got a good pool of resources within our service for young people to talk to. So if they need advice from social workers or drugs workers, health visitors, etc., we've got it all there. Young people can speak to us the week before and tell us what they want next week, and we'll get them things ready for them. And it works well because it's very informal. We find young people don't like speaking in school. A lot of young people not attending school. They don't like speaking in the office. They don't like speaking in general. But when they're sat down in the ring and everybody's hot, sweaty, tired, it's a good leveler. So it's working really well. So that's the personal development aspect of it. I said on the next slide, just give some of the examples of some of the things we actually discuss. And I said, this list is exhaustive. It goes on and on and on. It can be anything. We can talk about food. We can talk the conspiracy theories we talk about some weeks is hilarious, but it breaks down the barriers and it opens up the conversation for other things to come along. And everybody is inclusive, so it doesn't matter what they think. If they think they're going to say something that they think is silly, let them say it. It opens the conversation, it builds their confidence, and it's a good way to let them open up. And a lot of the things we do talk about are substances and violence, because we are a violence reduction project. And it's surprising that when young people are in that environment, they will open up and they'll explain then that they are using substances and they are concerned about becoming parts of gangs or getting involved in gang violence. Because a lot of the young people don't seem to realise that because we are quite a rural area, and they think about gang violence, they think about big inner cities. But a lot of the things they are sort of getting coerced into are gang violence. We have a thing in this area, they call them postcode fights. So, and it opens a conversation here. It lets young people explain to us that they are concerned about it. They are worried about getting involved in these things. And it gives us a chance to talk them properly and put things in place to try and combat them getting involved. And, as I said, some of the things that do come through are very comical. And yeah, it's a fun session. It can be hard hitting, but we make it fun. And we sat down, we're usually having a food or a cup of tea by this point, or having drinks, because we always eat together as well. That's one of the main things we do. Once we're doing the personal development sessions, we eat, because a lot of the young people, we know they're not going to get proper meals that day, but we ensure that on that day they're with us, they're eating. So when they turn up in the mornings, there's fruit there, there's always snacks, there's waters, there's drinks. And then after the sessions, we use local businesses to bring in food for us. So we know for a fact on them days they are eating, and we will send them home with food if need be as well. And yeah, the next one it says about the referral pathways. Sorry, Duncan. We accept referrals through, obviously for the youth offending service, because the majority of the young people who come through to us are referred through colleagues. The police can refer on children's services, as says on the thing, but that is expanding now at the moment. We are looking to set up links now with the the refugees who are coming into the area. It's a big piece of work, but we have started the ball rolling. Because it's so widespread across two local authorities, we've got to try and find venues, etc., etc. So we're constantly looking at engaging young people who are vulnerable, and obviously with refugees coming to the area, they are very vulnerable to being coerced, etc., etc. So the referral pathways constantly is building. We've just set up a partnership with Cardiff City Football Club. So they're referring in now, and they're starting to fund some of the projects. We've got a partnership now with the mobile phone provider EE. We go into their call centre, and we do some sessions with young people who are being referred in through the education department into EE. So it's a constantly building pathway, so we're not stopping where we go. We're going to continue because we want every young person to have the opportunity to engage in this project. And then, at the end, it's the last one. Sorry, Duncan. The last one, it just says about the Fight for Peace Alliance. The Right Hook Project is the first statutory organisation to become a member of the Fight for Peace Alliance. The Fight for Peace uses combat sports to prevent gang violence across the world. Because Youth Offender Service are not a martial arts or combat sports provider, we've got, like I said earlier, we've got in from the other way. We've actually got that, the participants there ready. A lot of organisations are trying to work with young offenders. We already have the young offenders working with us. So we sort of flipped on his head and we brought in martial artists and boxers and so we have actually got ex-Olympians working for us. We've got ex-world champions working for us. We've got a few UFC fighters who actually come in and do appearances and that sort of stuff as well. So we are very lucky with this. But yeah, as being part of the Fight for Peace Alliance, we are in the same. We got the same ethos as these. We want to use combat sports as a way to combat violence and reduce young people getting involved in actual behavioural crime or violence. But yeah, so it's going well. It's building. And we do appreciate the recognition you've given us. It's fantastic to be recognised for the hard work we put in. So that's my little presentation.
Thank you, guys. Martin. And it's lovely to hear. I mean, there is, I should say, no correlation between me becoming a member of the Youth Justice Board and us awarding our first Criminal Justice Innovation Award of 2023 to a youth justice service. But I think the work that you do exemplifies, I mean, I certainly know from the judging panel, exemplified a strand of work that we really thought was creative. And I think that final slide on how you're partnering with people internationally is really incredible. I could ask you a bunch of questions. I'm sure people on the line would want to ask you a bunch of questions, which they'll get a chance to do later. But I will, before we do that, I will hand over to Kathy Ashley, Chief Executive of the Family Rights Group, to talk about the Lifelong Links project, winner of the 2023 Nick Crichton Award for Family Justice. So over to you, Kathy.
Thank you. Firstly, to say hugely thrilled to get this award on behalf of staff and trustees at Family Rights Group, and it is a tribute to the young people, particularly that we've worked with, but also the families, practitioners, academics, and indeed funders who've been key to developing Lifelong Links and from the start. I'm particularly thrilled that it's the Nick Crichton Award, and in fact it's the first award I think that Family Rights Group has ever had. I knew Nick Crichton and I was lucky enough to for him to be a friend. He was wise, he was kind, he had an amazing inquiring mind. He was determined that our family justice system should be more just, and he was fiercely tenacious in pursuing his vision of FDAC. And I think we could all benefit from being a bit more like Nick. So I'm really pleased that we particularly got this award in Nick's memory, and also that we followed both brilliant previous winners, but also just paying tribute to others on the shortlist, because we didn't think we would win, because we saw the shortlist and thought the others were also incredibly impressive. For those who don't know Family Rights Group, we're a national charity, and next year will be our 50th anniversary. We do run an advice service for parents and kinship carers involved with the child welfare system, and that includes a free advice line staffed by advisors with specialist legal and practice expertise. So do direct families our way if they could benefit from our advice. There's lots of resources on the website, and we promote policies and practices to enable children to live safely within their family and strengthen the family and community networks of children who can't live at home. An example of that is in the early 90s, we brought over practitioners from New Zealand to talk about family group conferences, and that was the catalyst that led Family Rights Group to support the introduction of family group conferences in the UK. If you're not familiar with family group conferences, there's lots of information on our website, and I'm happy to discuss them at length. In 2013, we were part of the care review with other voluntary organisations that concluded that the care system too often breaks rather than builds relationships for children in care. Too many children in care and care leavers are taken, when taken into care, are split up from their brothers and sisters. They're moved away from their school, their friends, their parents, but also extended family who care and love them. And the situation is worse now than it's ever been. We've got a record number of children in the care system, and obviously you're all aware of the impact that that can have in relation to a child's isolation, in relation to their mental health, and too often outcomes for children in care are not those that we wish to see, whether we look in homelessness figures or youth justice or employment. So the concept of lifelong links was to turn around our current child welfare system in terms of, rather than breaking relationships, it was to value and to build relationships. And so lifelong links is based upon a really simple premise that we all need people in our lives who care about us, who we can turn to emotionally, practically, even financially at times. We all need that, and children in care need that even more than others in many ways, because of the trauma that many of them and loss that many of them may have experienced in their early years. So lifelong links isn't designed to find somewhere for a child to live. It's designed to help build a support network for the child. It was designed with care experienced young people as well as other stakeholders, and we were fortunate in getting funding which allowed us during a development period to look at what was happening internationally and learn from our experience in hosting the National Family Group Conference Network. We were able to look at the US, at Scotland, Australia, New Zealand. We looked at even in relation to different development crises around the world, to look at what tools have been used, what approaches have been used in order to enable children to have the support network that they need. So the approach involves a family group conference coordinator trained by Family Rights Group, using a range of different tools to explore who could be in the child's life. And the coordinator works with the child, their network, and the social worker. It places the child at the centre. It only happens if the child or young person agrees. It goes at the child's pace, and the child can stop it at any time, because it's their network, it's their friendships, it's their people to turn to. And it's not about doing two, it's not about imposing on them. It's about who they want in their lives long term. Alongside training Lifelong Links coordinators, Family Rights Group has developed the Lifelong Links Toolkit, and we've produced additional guidance on working with very young children, with unaccompanied asylum seeking children, non-verbal children, and young people aged over 16, including care leavers. We work with local authorities to embed the approach, because whilst the exploratory stage of lifelong links, finding people who care about the child, is important, actually, and having a lifelong links family group conference which brings the network together and celebrates the child is often a really moving, lovely moment. Nevertheless, it's crucial that the resulting lifelong links plan is embedded in the child's care and pathway plan and is consistently supported by the local authority. So what are the results? Well, We started on this journey in 2016, and now more than 2,400 children and young people in England, Scotland and Wales have benefited from lifelong links. We're currently working with 32 local authorities in delivering lifelong links. An evaluation of a 3-year trial by Professor Lisa Holmes found that almost 3/4 of the children and young people who were referred to lifelong links remained in their foster care or residential home in the year following their initial participation in lifelong links, compared to only 41% for a comparison group. And she subsequently undertaken a longitudinal study and found that that stability continues. The longitudinal study also found that it led to an improvement in the emotional health and well-being of children. In fact, measured by the Strength and Difficulties questionnaire, it led to a significant improvement in children's mental health. 78% of children and young people reported an improvement in their sense of identity and belonging, because although this is about developing a network, it's also part of the journey involves exploring actually their past, why some of those relationships may have been broken. In terms of the connections, on average, our data found that it led to an increase from 7 to 26 connections for a child, and some of those relatives, or finding lots of brothers, sisters who the child's not in contact with, or where contact's been broken. In some cases, fathers, in some cases, lots of grandparents, wide aunts, uncles, cousins, but also former foster carers, teachers, former social workers, schoolmates' mums, all those who in truth are, we have all sorts of children in our lives, don't we, who we care desperately about, and we look out for. And that's true in relation to lifelong links networks that we've seen develop. A study in Hertfordshire found that in 1 year it led to cost avoided of £800,000, and that includes a reduction in children going missing from care. Although the aim isn't to find a home for the child, inevitably in some cases where the connections develop, it does lead to some children living within their family network. And we've seen some really positive Ofsted judgments in relation to lifelong links, which I won't go further on about, but happy to talk about more. We're now looking about, we're working with some young people, young adults in care experienced adults in prison. We're extending lifelong links to adopted young people, and there are opportunities in relation to some government funding. We still got to find out more details. But if you are in a local authority or working with the local authority and want to develop lifelong links, then get in touch with us. There are possibilities and opportunities. And at this point, I'm going to hand over to Duncan, who's going to show a short film about lifelong links involving a young person who, Sandy, who experienced lifelong links.
Lifelong links. Take a right long think. It might not sink in until you hit the brink of this rink that's frozen, so break it open.
The mission of Family Rights Group is to create a more socially just society in which children are able to live safely and thrive within their family, and to strengthen the community and support networks of children who are unable to live at home. And that's where Lifelong Links comes into it.
Lifelong Links is where young folk get the opportunity to have an independent coordinator who researches that young person's family and then reaches out.
Seize the moment. Realise the importance. The good that it does builds foundations for love, helps rise above past use of drink or drugs.
We started being curious about lifelong links about 6 years ago, just asking questions of some of the youngsters that were coming into our care system, wondering who else was in the family, who else was there, who else was important to them.
I remember I was about maybe 12, 13, because I knew I didn't have much of a family, and I remember feeling quite isolated. I felt really disconnected because everybody had like some sort of idea of family and where they came from, and I just knew that I was in care and that was very, very different, and I was just really scared about like what the future was going to have in store for me. It's not about them and it's not about you. It's about finding the ones that love me too. In a world that's askew, filled with drink and abuse, I think that we should find the family that's good.
They will have a birth family and people that were around probably when they were quite a bit younger that have been important to them, and we can't just rule these people out and not do anything to kind of keep them connected.
I think one of the biggest fears I had was about being rejected. From my perspective, I went into care because my family didn't love me and nobody wanted to be involved in my life, and that was my whole understanding of it, and it wasn't the case at all. Most people were actually really, really excited to hear from me.
A lot of the relationships that Lifelong Links has brought about should never have been broken in the first place, so we need to shift the system so that doesn't happen.
I think the biggest surprise for me was probably getting in touch with my auntie. She'll have some of the answers as to like the questions I had about my mum. I wanted to see my brothers, wanted to know what they looked like, wanted to have a relationship with them, and I actually have that now. Things just feel a bit more normal. I feel a lot more connected because I have family now, like most people do, and it's been mind-blowing, really. Not sure what to say, not sure how to act, and now it's a fact, I got my family back.
Great. Thank you, Kathy. That was excellent. So we'll move on to the panel section of the event, and I'd like to ask Martin and Kathy and Naomi and Amanda to turn their cameras on and their mics on, so we can have that. And as they do so, I'll also invite Naomi and then Amanda to speak a bit, very briefly, about their projects, just so people on the call have a sense of it. I know Duncan's put profiles of those projects from the Map of Innovation in the chat for people who want to get into it. So Naomi, you first, if you just want to talk a bit about the wonderful work you do on Aspire.
Brilliant, yeah. So I manage the Aspire project for probation, which is funded through the Tackling Paramilitary programme. And I suppose I moved into this role from managing a generic probation team. So completely different kind of way of working, far more innovative, far more, I suppose, creative and person-centered. So I'll just take you through kind of the different things that we do within the project, because there's different sections. And if I use any jargon, which like doesn't make sense, just shout out and say to me, because I'm terrible at realizing that. So we kind of have three sections. So the first is statutory. So that's really like, as probation service, we manage orders and licenses. So service users can be referred in for support from the Aspire project if they're on a license or an order, and basically the local probation officers would identify those cases. So what we're looking for is cases where young people between 16 and 30 are at risk of getting involved in paramilitarism within Northern Ireland. So sort of going back to our context of the Troubles and paramilitary still being existent and still influencing our communities and getting people involved in criminal behaviour. So we're trying to stop young people getting involved in that. So identified risk factors which lead young people to get involved in this type of behaviour would be having drug debt, lack of purpose, drug and alcohol issues, a threat being issued to them, so the police would have informed them that paramilitaries are looking for them, lack of parental control growing up, unemployment, intergenerational trauma, and really sort of the service users that Kathy's been talking about, and Martin, in terms of sort of young people who've had a lot of problems growing up and then they're at more risk of being involved negatively in the community. So when those sort of risk factors are identified, they can be referred into Aspire. And what that means is that they will get more intensive support. So alongside being identified a probation officer, they'll also get a probation services officer allocated to them, and contact will always be at a weekly basis, regardless of what their assessment of risk is. And they will also have supports available in terms of our psychology service. We have a line psychologist, and we also have support from a CERT, who are like an addiction service, but they also do dual diagnosis. So really, really interesting support that we have available. So I suppose in those cases, my staff get involved, look at supporting these people, or these young people with these issues identified, and it is far more person-centred. Staff would try to engage people by bringing their dog out for a walk with them, bringing them swimming. It's not traditional probation work where you're sitting in an office. You know, we're trying to be more reachable to young people and try to really keep them engaged and focused. And then we would do all that we do generally in terms of probation, in terms of offence-focused work and trying to get people connected with the community. And that's really the key thing, connection, you know, which I think has come across in what Kathy was talking about too, you know, trying to build on family relationships and trying to get people connected with their community, because the more we get them connected with the positive, the less we see them getting influenced by the negative. So that's really the statutory part. Then we have a mentoring only service, which is for the stat cases, where they can get support from a mentor from NIACRO, who would work with all our stat cases as well, but it's just for ones that maybe don't need that intensive support from us, but they do need some practical things done. So the mentor would sort of support with housing issues, you know, getting registered with the GP, all those sort of practical things that a lot of young offenders need support with. And then the third section is non-stat cases, and that's individuals who aren't subject to probation order or license, but they are needing support and have those identified risk factors. So our partner agency, NIACRO, would look at supporting those individuals. And quite often they're referred in from the likes of police or different community agencies as young people who are at risk. So I suppose everything they're doing as well is focused on trying to get that young person engaged. In terms of sort of the service users we work with, there's so many different different people we're getting at different stages. A lot of the time we're getting people who have a lot of offending built up and they're very chaotic, and it's about us trying to get them to a point where they're ready to change and ready to engage with the positive things that we have to offer. And I suppose it's about continued research, you know, where we've had the opportunity to put all this in place, so it's about learning from it. So we had research done with Dr. Colin Walsh from Queen's University, which was published earlier in the year. And me and him are starting research soon in terms of looking at, is there the right services for the increasing complexities that young men present with? So looking at what we maybe need to do better, because we're seeing sort of within statutory services, it's very hard to find the right service for these young people because there's just so much trauma, mental health, addiction. So that's kind of a brief overview. I'm more than happy when we go to the question and answer, just I don't want to talk all day. But if anyone has anything, more than happy to pick up. Thank you.
Thank you very much. And Amanda, similarly.
Thanks very much, and it's great to be with you all and to hear from the other fantastic projects. So our programme is For Baby's Sake, and we work with the whole family. We work therapeutically to empower both parents to break the cycle of domestic abuse and give their baby the best start in life, especially when the parents didn't have that themselves. A major evaluation led by King's College London found that For Baby's Sake was the first programme to address key limitations of whole family responses to domestic abuse because of the evidence-based combination of support that we offer to both parents. So they both join the parents using abusive behaviour and the parent experiencing abusive behaviour, whether they're together as a couple or not. And we start in pregnancy. The evidence says that's the best place to start, really. And we continue up until the baby is 2. And through the combination of that therapeutic work, that therapeutic relationship between the parent and the practitioner, they each have their own practitioner, and through the combination of robust safeguarding, trauma-informed and attachment-focused support. We empowered the parents to make those changes in their life, harnessing that motivation to give their baby the best start. One thing I would say is that our work resonates so strongly with one of the latest reports from the Centre for Justice Innovation, your report on substance misuse, trauma, perpetration of domestic abuse, and the perspective of family drug and alcohol courts. And so it's extra wonderful, really, that we won the Nick Crichton Award, given that all he has done to pioneer FDACs.
Thank you very much. So, as you can tell, 4 really fascinating projects with 4 really fascinating spokespeople presenting. So we're going to get to the kind of Q&A section, but I'm going to sort of start it off with a couple of questions from me, and then as people form questions in their head, if they can put their hands up, and when I call on them, then, as I said, turn on their cameras, ask a question, but also tell us a bit about who they are and where they're calling from. So in my sort of first question, so I've been reading a book that 2 of our trustees at the centre have written, called Gradual, which is a book about incremental change leading to kind of social impact and incremental innovation. And one of the things they talk about, which I assume you guys will recognise, is that the programme you deliver is often not quite the programme that you envisaged delivering when you first started. So I guess the first question for me is, for anyone on the panel, is what's the thing that's most surprised you about how the project that you run has evolved? I don't know if anyone wants to put their hand up and tackle that one. Martin?
Yeah, well, we initially started the project just to work with young people who were NEET, so not education, employment, or training. But we found that it started working well with the young people there, but then the word spread, because we don't use social media or anything like that. And now we're literally working with so many people, and it's gone completely. It's blown away from the initial sort of starting point to where we are now, and where we can continue going. We didn't envision it being this big and this sort of successful, if that makes sense.
Yeah.
So yeah, we just, like every other project, we've got to keep moving forward. No point being stagnant. We've got to keep moving, because everything else changes.
You're on mute, Kathy.
Yeah, I think for us, there's a few things. One of which is that although it was primarily about developing a support network, I think we didn't envisage quite how much it would end up being life story work, about how much it would end up with children, young people just desperately needing to find actually why situations had occurred as they are, and also positive stories about family members who, according to sort of care files, may have been portrayed in very negative ways. So even finding out that their mum had gone to the parents' evening, when they were very young, and that sort of, just some positives in their lives, I think. And the other is how many former foster carers, as well as former teachers, and actually quite often some of the children feeling a great deal of responsibility for the fact that the foster care placement had broken down, but having a lot of affection for those foster carers, and actually this being an opportunity to being able to address that with both the former foster carers and themselves, who'd always held affection for each other but always felt guilt about why that hadn't worked. So those are just a couple of examples.
Interesting. Amanda, Naomi, do you have any? Yeah, Amanda?
I think one thing that perhaps surprised others more than surprised us at the outset was the willingness of both parents to come on board. And when we started, bear in mind that we started designing this in, 2011, 2012, and we opened the doors in 2015, and we were bringing on board both parents simultaneously, each having their own practitioner, of course. And, there was a lot of questions about whether that would be feasible. And actually, it is really, really powerful. and it works, and both parents do want to get involved and get the support. And I think one thing that isn't such a surprise really, but something that's become so fundamental to our narrative and actually has woven through what everyone has said has been how we realise that we start working with parents at a time when they have a really quite an insecure sense of self. And how we work with them, and through the work we do with them, they end up with a much more secure sense of self. And that's woven through what all of the contributors have said so far. And you know, that's the roots of being able to build and sustain resilience for themselves and also for their baby and their families.
Yeah. Naomi, do you want to add to any of that?
Yeah, I think just in the sense that, you know, probably there's been things that have happened since I've sort of been managing the project that I didn't really envision, you know, who I would have seen as our stereotypical sort of group of service users has been different, you know. Like for example, this year we've had like, you know, unaccompanied minors ending up being referred in, and I suppose for me, I always thought it would be more Northern Irish males that we'd be working with, but actually you can see the reach goes beyond just that sort of population. But I suppose sort of overall as well, in terms of, I've probably found that the project has taught me a lot about criminal justice in general, you know, in terms of stuff that kind of things that you maybe wouldn't have realized, you know, seeing how being creative with how you work with people can actually have benefits, and sometimes not just always looking at things with, you know, being able to weigh up decisions and being defensible, and it not just being seeing risk, being able to say, you know, what could be the positives of this choice. So I think, you know, it's kind of added a lot and sort of changed, sort of maybe implemented changes to other areas of probation, if that makes sense, from the learning we've had from what we've been doing.
That's really useful. And that sort of leads me beautifully into the next question I was going to ask, which is the question of creativity. So I think often when I speak to friends who don't work in justice, whether that's family or criminal justice, they think innovation, like, is that a thing that happens in the justice system? And equally, you know, I think for a lot of practitioners that we meet, they're frustrated by the boundaries, by the kind of limitations of the national conversations. So sort of, I guess it's sort of, how have you found the kind of, how do you operate, how do you use your creativity in spaces that feel sometimes quite boundaried? I don't know if anyone's got sort of thoughts about that.
I think it's a challenge that we're all going to face at the minute, especially with budget cuts. So I'll just go ahead and say, I think it is kind of, I think for me, it's about the foundation of it to begin with, in terms of, you know, for the work that we're doing, it's so much trauma is involved. And I suppose it's about making sure that my staff who are working with individuals are trauma informed, but also I'm trauma informed with working with the staff that I manage. So I think it's about being able to kind of look at cases case by case, and kind of looking at, when we say creativity, I think, you know, it's about looking at what's already there for them and being able to build on that, you know, and looking at how you do engage someone. It might not have any impact on needing further resources, but being able to, like the likes of, we literally have service users who won't meet my staff unless they come and pick them up with their dog, and it doesn't have any impact, you know, really on us, you know, but it gets them to come to the appointment. So it's just about trying to kind of look at that, and I think probably working as a team is crucial for that, you know. Like I'm not doing the day-to-day work with service users generally, so my staff are the ones who are the experts in that, really. So being able to kind of use different sort of lenses to try and work at it. But definitely I think in the current environment, being creative is definitely going to be crucial for everyone.
See lots of nods. Kathy, did you want to come in?
Yeah, I would say I am exceptionally lucky because I have a really creative staff team. I mean, they are far more creative than I am. Sometimes you have to sort of quell their creativity when it gets a bit carried away, but it incredibly. So, and also that all the way through, young people, co-experienced young people, have been involved and have driven. So a lot of the sort of developments have been driven by them rather than ourselves. I would say you also need consistency. I mean, we've got a accreditation system, we've got clear sort of framework in order to ensure, you know, that the approach never does harm. That's the sort of, you know, so there are sort of boundaries as well. And we also, when we start to work with a local authority, we insist on meetings with their directors, with the lead councillors, so that there is buy-in from the top, because people get the idea of lifelong links, but actually there has got to be commitment all through the system. So that's one of our conditions. Yeah.
That's useful. Martin, Amanda?
Yeah, sorry, yeah, going off what Kathy's saying and what Naomi said, we speak to the young people a lot. We use young people as mentors as well, because their voices, at the end of the day, is their project. So if they want to move forward with things, they want to try new things, they want to diversify, that's something we look at. You know, it's not just us running the project, it's a partnership with the young people, as a partnership with the communities as well. So there's a lot of talking going on, and we're probably the same with most of the projects. We beg, steal and borrow wherever we can to keep things going. You know, we're all juggling money, we're all trying to find different pots, etc., and thankfully majority of projects make things work, and you know, all you take your hats off for doing that, because it's a hard part of the job. But I'm lucky enough I have got some good staff members as well, and like you said, they're creative. We have got dogs coming to the gym as well, and it makes a massive difference. It's surprising. A dog can be absolutely fantastic. You know, simple things like that. But yeah, we just got to keep creating and just keep plugging it, really, haven't we?
Yeah.
Can I just add in there, because you said about what weren't we expecting, and we weren't expecting the number of pets who have ended up coming to Lifelong Links family group conferences, because, you know, particularly when you ask children what they miss and what they're worried about, it often is like their family or former foster carers' pet. So yeah, dogs seem to be the running theme here.
Isn't it? It's good for when people are wanting to talk as well, because you can kind of take away the eye contact by stroking the dog. You know, like it works well. Yeah.
Amanda, did you?
Yeah, so, thank you. I'd add a couple of points. When we started designing for Baby's Sake, we scoured the evidence, which was very fragmented. So the innovation partly started by bringing together those fragmented evidence bases, you know, attachment focused support for parents and the importance of baby brain development, infant mental health, what it takes to support and empower those who've experienced domestic abuse, what it takes to support those who are using abusive behaviour to make change. So I think joining all of those dots together was part of it. I think also holding a real belief in the possibility and potential of change and holding on to that hope, while at the same time being realistic and having a safeguarding first attitude. I'd also back up what other colleagues have been saying about the importance of the emotional well-being and emotional health and feelings of safety for everyone on this journey. And in fact, we've just created new emotional safety plan tools, one suite of tools for parents to identify and record what they need to feel safe before, during and after birth, and then parallel tools for all of the professionals and anyone else who's supporting the families on that birth journey. And I think, you know, that emotional safety is really key, particularly, I think, to sustaining innovation.
Yeah. And as someone who's fighting a losing battle about keeping dogs out of the office at the centre here, and as a cat lover, I would just make a plea that cats are also awesome too. Anyway, it's not really important. My last question, and then we'll open up to the audience. So if people can start thinking about what their questions are and start putting their hands up, that'd be great while the panel asks this last question. So I guess, just for everyone on the call, so what's the biggest lesson you've learned over the past couple of years in running those projects? What's the biggest lesson you'd want other people to hear? Big question, but I'm sure you've got multiple answers to it. Martin, you look like you're gearing up for an answer.
Yeah, right. Okay. Yeah, I started this project, the idea of the project 2019, and then I went to the senior executives of the local authority and managed to have £50,000 funding. But then we had Storm Dennis, and then we had the pandemic, so that money was taken away. So what started off as I thought it was going to be, we were going to be flying. We had nothing. So we started with nothing. We've gone through the last 3 years with basically nothing, but we're getting it done. So I think the only thing I can really say is don't give up. If you've got a project, it might sound like a pie in the sky, just go there. Because if somebody doesn't start, it's never going to get done. And the young people may be missing out on some of that could be a great project. So yeah, I know you all are resilient people and fair play to you all. But yeah, somebody's got to do it, haven't they?
Yeah.
And that's it. So that's my word of advice really for that day. They just
keep trucking
crack on and go for it. Go for it. That's all you can do.
Other answers from the panel?
I think I would say probably the importance of stories. So I suppose the young people we're working with are generally not the people that like we're talking about men. I think sometimes people can have a lot of empathy for children, but when they're adults and they're offending, you just see the behavior and not them. So I think the importance of hearing the full story of what their childhood has been, what has built them up to that behavior, and understanding the person. And I suppose alongside that, time being spent with someone and the value that can be. I think so often in the work that we all do, there's pressures and it stops you from being able to give the time, but the benefits you see from sort of building that relationship. And I know that that's kind of something psychology keeps sort of saying to us, therapeutic alliance, and that's really built, the importance of that, in terms of actually being able to then work on behaviors, actually having that relationship built. So they'd probably be two big things, and probably the overall thing for me would be there's not enough for these guys. So I suppose it's about my role as a manager then to shout that out, that we need better statutory services, and that's part of where our research is going now, to look at being able to actually, we know the outcome of the research, but we're doing it so we can then advocate that there are better services in place for these vulnerable people.
Thank you. Kathy or Amanda?
I think I'd build on what Naomi was saying, because I was going to come in with the same sort of point about, relationships heal relationships. It's not something new that we've learned, but it's absolutely at the core of how we work. And I think also, as we think about the outcomes that matter in our program, thinking about the outcomes that really matter to unborn babies, children, parents, families in society, and holding true to those outcomes. They're not the easiest to measure, but they really need to drive the system change that draws on the learning of all of our innovation.
Yeah. And Kathy, do you have a pearl of wisdom for everyone?
I think, well, I suppose there's a couple of things there about one of my colleagues is just about the breadth of relationships that young people need, and how, because we're very clear it's got to go at the young person's pace, that often doesn't quite work for the local authority. And actually, this isn't about organisational convenience, this is about what's right for the child or young person. So that can be quite challenging. It has to be part of a wider system shift. If you are sending children far away from family and friends, if you're not prioritising those relationships from the beginning, then lifelong links can do some repair work, but you've got to also be addressing what's going on more widely. So it can't be instead of that, it's got to be a catalyst. And that's what we do find quite often, that it is a catalyst for that. I suppose the other thing is that we have, there's an expectation sometimes that it's only those authorities rated excellent or even good that will do this well. And actually, you'd sometimes find some extraordinary people in places that have even been rated poor, or all the rest of it, and actually working with them is also inspirational. So it's important not to sort of presume anything about local authority based on an Ofsted judgment, I would say.
Yes, very good point there at the end. So it's time for the Q&A from people in the audience. So people start putting hands up. We've already got a question submitted in the chat, which I'll come to first. So from Mark Powell, who I don't know if he's still on the line or had to leave. So he asks, I had a question about what support do the projects need, brackets, apart from more money, and what one thing should statutory organisations take and use from what these projects have done? Obviously, a couple of the projects are in statutory organisations anyway, but I don't know if anyone had any sort of answers to that question. You know, what sort of support do the projects need, brackets, that's not money? And I guess maybe more broadly, how do we systematise some of this learning across statutory organisations rather than them just be sort of small pockets of practice? Has anyone got any thoughts on that question from Martin? From Mark, sorry.
I'd probably answer kind of the second. I just started typing out and answer probably more to the second part. I just said that I think the importance of stat agencies working with community supports and families to ensure that there's the best support for the service user and a more holistic view. I think stat agencies have a different lens, and coming from that lens as well, you know, when we work with our partners in the community sector, you know, very different sort of perspectives. And I suppose then in terms of like what support other than money, I suppose it's about, you know, like referring and advocating for, you know, projects, you know, and making sure that you use them. Obviously, I know I'm probably very separate from a lot of people in terms of where I'm located, but you know, I know that's probably a big thing for us, making sure that people chat about it and boost it, and then it keeps it in the public light and hopefully keeps funding going, which kind of interlinks to the money part.
Shall I go next? I think one point is realistic acceptance and embracing really across the whole system of what it actually takes to empower parents with trauma histories and complex needs to break those cycles of poor outcomes and trauma and give their babies the best start in life. And also, I'd say, to overcome the persistent baby blind spot in decision making and to recognize the value in every sense of starting in pregnancy.
Yeah. Anyone else want to jump in on that, or should we move on to other questions?
Can I just add in, and particularly it's interesting, Amanda, talking about starting pregnancy, because some of the work, particularly focused around family group conferencing, is about the importance of that offer early in pregnancy, and just to promote the best practice guidelines and working with parents or parents to be whose children are at risk of removal. We know there's huge variation across the countries in relation to the chances of your newborn being subject to care proceedings, and often those women, particularly when we're focusing on mothers, are care experienced themselves. So just reinforcing Amanda's point. I think the second is we need to change hearts and minds and attitudes, particularly in relation to families involved with the child welfare system and children in care. I mean, and that includes unaccompanied asylum-seeking children. So if I could do one thing aside from money, it would be, I mean, Nemi's talked about storytelling, but it is, and what I would ask you to do is to raise awareness about lifelong links, because it's a very helpful way of introducing how we can change presumptions, attitudes, stigma about children in care and their families. And then what one thing could statutory organised take and use, I would say it's back to the importance of valuing relationships for all of us.
Yeah. Martin, did you want to come in on that, or should we move on to the next one? Because someone's already teed up a question that's directly aimed at you anyway.
Go to the next question then.
So yeah, the next, Richard, I don't know if you wanted to ask it. I know Richard White's on the call. It's his question. I don't know if you wanted to ask it personally, because you might want to describe what you mean by social prescription, Richard.
Well, I suppose I'm interested to know whether Martin knows what it is.
Social prescription.
Yeah.
Oof, tricky one. As in, like, linking in with community activities, community groups, that sort of stuff. Is that what you mean?
Well, it is something that can be prescribed by GP practices, but and I know there is one in Plymouth because I heard it talked about quite recent, a couple of years ago now. But it doesn't appear to be widely known, but it seems to me to be a very good idea. I don't know whether Phil has heard of it. No?
It's just a bit like the old GP referral system when GPs would prescribe activities such as fitness and stuff for patients. Is that a similar sort of thing you're talking about?
Yeah.
Right.
But it doesn't seem to be commonplace. I mean, I live in Richmond in southwest London, and I can't find anything about it locally.
No, it's not something that we.
About it seems to be quite impressive.
Yeah, it's not something we come across.
To your local GP.
Yes, we do get young people referred in through health visitors, and we do a lot of work with young people who are suffering with anxiety, etc. We do run an ASD group, so yeah, in a way it is kind of, but it's not actually described as social. It just comes through referral pathways. But it's a great idea. I think it's fantastic. I think if more young people could be prescribed or advised to go into sort of sports and so on, it'd be a massive help. It really would.
I'll come back to you on that, Martin.
Thank you. Cheers, Richard.
Has anyone else got any questions for the panel? I'm not seeing any hands up, but I can't believe there aren't people who do have questions. Well, given that we seem to have a very silent and compliant audience, which is not that common for Centre for Justice Innovation events, I'll ask, I guess, just maybe some slightly closing questions then. So I guess sort of what are your plans for the long term for each of you? What are your plans for the long term, especially when it comes, and we've talked about this a bit, when it comes to sustainability of maybe not just the project, but sort of what are your ambitions for the future in terms of the broader systems? Maybe I'll ask that to Martin first and then just go through.
For the project itself, we're still looking for a designated venue. Like at the moment, we are here, there, and everywhere. And I think it says in the report that if we had our own venue, then we could offer more support for young people, as in drop-in services, etc., etc. They only see us maybe 1 or 2 hours a week per group. We want to be able to drop in whenever they can, so we can do more support there for them from social workers, health, mental health, and so on. At present, we've been asked by two more local authorities. We can sort of start rolling the services out into other areas as well, and that's something we'll be looking at. But that all depends on staffing costs and you know. But yeah, we taking the project forward. Yeah, we just want to make it accessible for everybody, really. We're looking at looking at children with disabilities, etc. It's got to be inclusive for everybody. So we're constantly just trying to moving forward. Like every other project's going to do, we just got to keep going. And if we got to adapt and change, we'll adapt and change.
Yeah. Kathy?
So I'm rather ambitious in my aims. So I want it to be an offer to lifelong learning, to be an offer to all children in care and care experienced young people. We know that there are some children who are less likely, the evaluation showed some children are less likely to be offered it, not just in terms of their local authority not offering it or not having lifelong links, but even those authorities that do. For example, children in children's homes out of area are less likely to be offered lifelong links. So we want to address that and challenge particularly exclusion of disabled children not, you know, again, when I say exclusion, I mean they're less likely currently to be offered lifelong links. We want to break down that barrier. We want it to be an offer to all care experience young people in prison. So again, huge challenge, but actually it's back to the really fundamentals that everyone needs people in their lives to turn to emotionally, who love them, who care about them, where it's meaningful. And we've got to create the mechanisms within our statutory services to make that a reality. And lastly, because we're responding to the government's children's social care strategy, or the English government's children's social care strategy, we think far fewer children need to be in care if the right support was in place at an earlier stage. So just throwing that out there as well.
Yeah, yeah. I was going to ask you about that consultation, which I think is due to close a couple of days from now, which is obviously
tomorrow night.
Tomorrow night. Okay, well, we should make sure our consultation response goes in later today. Amanda.
Thanks. Well, we've started expanding the provision of For Baby's Sake across the country, and we really want to crack on with that. We began with area-based teams, and then during lockdown, when we took the programme to being delivered, you know, through video calls like this, and find it was really effective, we realised actually we could deliver the programme to families living anywhere in the country. So we want to continue with that expansion. You know, we're in local authorities from Durham to Dorset, and also in England and Wales, and love to be in Northern Ireland, of course, coming from Northern Ireland, and in Scotland too. So expanding the provision of the For Baby's Sake programme, and then also continuing to build on what we started to achieve that ripple effect. So to take the transferable lessons from how we work and help to share that across practice and policies and systems. And we've started that with some training and other offers of support and sharing tools and resources. And in fact, everyone on the call, if you go to our website and go on the system change section of the website, you can see where we started to share tools and resources that have been very useful to the families we support, and that we think be very helpful for the wider practice in the system. And of course, going back to what I said before, at a system level, reaching that point where public policy fully embraces what it takes to empower families to break the cycle of domestic abuse, and also to see that shift so that the support that families need in pregnancy, both mums and dads, both co-parents, and to start in pregnancy.
Right. Naomi?
Probably two things. Probably firstly, I think we need to improve sort of relationships with some other housing, probably being one of the biggest ones. You know, there's very limited housing opportunities for the young people, a lot of very chaotic temporary situations being offered. So that's something we've already built on. So probably around sort of our relationships with stat agencies. I think we've got really good ones with like our community links. And then the second would probably be, we cover obviously the whole of Northern Ireland. We tend to get a lot of referrals in the Belfast area, which is fantastic, but there's certain areas sort of in the rural areas we want to reach more, where there's definite, you know, paramilitary activity. You know, there was a attempted murder of a police officer a while ago in that sort of area. It would be great to see more referrals coming through where there's definite influence in those communities. So I suppose trying to reach those areas and trying to promote referrals within that area would be something that I need to prioritise.
Yeah. Right. And we've had actually one final question, which is a really good one, and my fault for not mentioning this earlier. And I think all of you have touched on it a little bit, but a question from Nikki, who I think is a mother who went through a family drug and alcohol court, and who did a brilliant conversation at our problem solving court conference only a couple of weeks ago. She asking about how the projects offer opportunities for service users, and how those with lived experiences get involved, I guess, both in the delivery of the program, but also shaping the future of the program. I don't know if anyone wants to speak to that aspect, which I suggest is also something that I should have said, right, what I should have included in my questions. Very good question.
I'm gonna go first because my computer's gonna restart in a few
All right.
minutes. So I'll be leaving at that point because it'll just go on me. I've snoozed it too many times. We probably in general try to have service user involvement across probation, but within our service we've tried to start up service user groups. I'm going to be quite honest, it's been a complete disaster. Every time we've tried to get one going, we haven't been able to get attendance rates going with it. But we've given it a go, and I've probably adapted more to trying to get the feedback kind of more at an individual level, and it's kind of working better. I think what we envision starting maybe in the next couple of months is maybe actually doing something like walking together rather than it be coming into, I think we're trying to make it too much of a cliche sort of social work thing, come in and sit in a meeting room, you know. So I think we're maybe going to try and do it a wee bit more practical. But definitely I think that's probably something we could develop and do better at, you know. And I think that's really what we're wanting to do as an agency in general, trying to keep service users at the focus and their feedback and, you know, implementing what happens in the future.
Anyone else want to?
Yeah,
Amanda?
Kathy, could you go first?
So we have a parents panel of parents with lived experience. That's that's integral to the charity, and they were key in influencing how lifelong links is developed. And the same with a kinship care panel. So if there are parents or kinship carers interested, getting involved to do let us know. And care experienced young people we haven't run a care experienced young people's panel. We've gone through either children care councils or apprentices involved in local authorities who are care experienced, who've been involved in co-developing guidance or training, and individuals who've been through lifelong links who've said they want to get involved. But we're about to formalise that more and develop a young people's forum that we run ourselves. We've also, I mean, half our trustees are those with lived experience, the child welfare system, including our chair. So it's sort of embedded in the organisation. So all lifelong links training, or for example, always includes families and care experienced young people within that training. So it's we try to make sure it's absolutely embedded throughout, but we know we need to continue to develop that and improve it. We know it's a continual improvement circle, really.
Amanda, and then Martin.
Internally, constantly learning from the reflections of our parents as we evolve the programme. Our parents have also contributed to sort of system change initiatives and practice change initiatives. So notably our Blackpool team, the parents, mothers and fathers in Blackpool, have been very involved in the Born into Care initiative. We've also, through research and focus groups, supported particularly fathers to get engaged. You know, there is a growing recognition about the importance of strengthening engagement with fathers. So we've been very involved in a fathers engagement project in Hertfordshire and brought fathers into workshops. And the other thing I'd say is that our parents are very keen to share their stories to give something back. So we've made a number of films now where parents have shared their story about what brought them into For Baby's Sake and the difference it's made to them, to help draw out the key change mechanisms within the programme. And then also, most recently, to participate in a suite of Safer Beginnings films to encourage parents, expectant parents, to come forward and seek help when they're using abusive behaviour and when they're experiencing abusive behaviour.
Okay. And it looks like we lost Naomi in the middle of that, but Martin.
Yeah, like I said earlier, we discuss everything with the young people going through the course. But what we'd run as well, we run a mentoring program as well. So after a young person runs for 12 weeks, or they attend for 12 weeks, and they feel confident to become mentors, then we'd put up, we'd sort of train the young people up to pad holding and things like that, and they actually take sessions then as well. And that's really good for the young people coming through the new ones, because they realize then that it's not just the adults who are look at overseeing everything, it's the young people itself. So they are part of the core of the project. And then they've got a lot of young people then want to become mentors because they enjoy the responsibility then of encouraging new people through the door, simple things like handshaking, asking names, stuff like that. So yeah, it's the peer mentoring sort of thing that we use a lot. We find that quite powerful, and young people enjoy it as well.
Excellent. Good. Well, without further ado, I can see no further questions in the chat. I see no hands up, and I am also aware that I'm in between you and probably lunch times, so I don't want to. I can give you back 2 or 3 minutes of your lunch hours. So I just want to again thank the panelists, who I think all will agree show some of the values that we as an organisation want to trumpet loudly: humanity, humility, creativity, and resilience, amongst other virtues. So thank you all to all of you for presenting today and for all the great work you do. Thanks everyone online for attending. Thank you to all our funders and sponsors, those who fund us to do our work, those who have funded these particular 2 awards. If anyone on the line has a project they'd like us to consider adding to the map, please do email us or share it in the chat. And then just finally, on the housekeeping of this, we will make this recording available. So if you want to receive it and watch it all again over your dinner or something like that, please make sure you're subscribed to our newsletters to get it. So get in touch with us at info@justiceinnovation.org or my colleague Duncan. So without further ado, I'm going to give you 5 minutes of your lunch hour back. Thanks again to everyone, and I hope you all have wonderful days. Thanks very much.
Thank you, guys. Much obliged. Nice to meet
Cheers.
you all.
Bye.
Take care. Keep up the good work. Bye bye.